Hello and welcome to Labour Lens. I am Sharon Ijason. On this week's episode of the program, we'll be focusing on COVID-19 and how it would affect workers across the globe. We will be right back.
The ILO's report today shows that we could lose between 5.3 million and 24.7 million jobs worldwide this year as a consequence of the pandemic that we're living through. But nothing of this is inevitable. A lot depends upon the policies we put in place to respond to the crisis that we have. What types of policies do we need? Well, at our workplaces, we need to protect workers. We need to put in place alternative working methods, telework and the rest. We need to make sure that people have access to sick pay. And at the same time, companies need to be helped. Many are in difficulties now. Governments have to invest in keeping them going and making sure that they keep people in work. And if we look at the bigger macro picture, we need the right fiscal policies and the right monetary policies. And we're seeing governments reacting now, and that's great. But we also need an international coordination of these efforts. We had them in 2008, 2009. They stopped the worst things from happening after the global financial crisis. We have to apply the same logic, the same common determination to today's circumstances.
Called by the Director General of the International Labour Organization, ILO, Guy Ryder, for urgent large-scale and coordinated measures across three pillars to tackle coronavirus pandemic. These are protecting workers in the workplace, stimulating the economy and employment, as well as supporting jobs and incomes. These measures include extending social protection, supporting employment retention, short-time work, paid leave, and other subsidies. Many economists have also recommended financial and tax relief, especially for micro, small, and medium-sized enterprises. In addition, economists across the world have proposed fiscal and monetary policy measures and lending and financial support for specific economic sectors. Nigeria's Finance Minister Zainab Ahmed gave government's reaction to the development.
I just say the ballpark figure is about 1.5 trillion, the reduction of the size of the budget, and this includes 457 billion from PMS under recovery. So we're expecting that the states also will be taking similar measures to amend the commitments, the plans that we have made to bring our plans down to current realities. And it is just a question of deferring some non-essential expenditure so that when things turn, we might actually go back to our plans. There's already an instruction to stop recruitment. What agencies have been doing is, they call it replacement. So they call it replacement, but even that is being suspended. And when things improve, we will go back to the issue of recruitments. But for now, our wage bill is already very high. We'll be looking at how best to make sure that the president has directed that salaries and pensions must be paid unfailingly. So we're not looking at downsizing in any way.
Underemployment is also expected to increase on a large scale as the economic consequences of the coronavirus outbreak translate into reductions in working hours and wages. Self-employment in developing countries, which often serves to cushion the impact of such changes, may not do well this time because of restrictions of movement of people.
Country responses to the pandemic are varied, but largely dependent on the severity of infection, spread of infection, and capacity of states' preparedness of the countries affected. Sadly, never in the living memory has any pandemic led to the quarantining of this number of people across the globe, as countries lock in millions of their citizens, lock down entire regions, and shut doors against travelers from other countries, especially the ones considered as epicenter of coronavirus virus disease. Nigeria, like other countries at risk, has fashioned a national strategy for combating the virus since the first detected case in Nigeria on February 27, 2020. Our national strategy includes active surveillance, early detection, isolation and case management, contact tracing, prevention of onward spread, and sharing of full data with the World Health Organization and other relevant authorities. At this moment, there are 4 diagnosis centers in the country. Also, there are a number of helplines. We have been made to understand that there are a few quarantine centers. The leadership of the Nigerian Labour Congress wishes to brief Nigerian workers on our own strategy, the workers-based strategy, which is complementary to the national strategy. A worker-based strategy is necessary given that workers are at the front line risk, given their exposure at point of entry or departure, or hospitals, or any other place of interest. In the face of COVID-19, workers are also exposed to secondary risk as threat to loss of jobs or actual job losses. A work-based response is also essential, given that in times of national or international emergency like this, sectorial or organizational responses are usually helpful in minimizing impact and finding sustainable solutions. In furtherance of this, the Nigerian Labour Congress has decided to issue this as an advisory to workers, governments, and private employers of labor, both informal and informal sector across the country. This advisory focuses on creating awareness of the workplace issue on COVID-19, fashioning out a support-based, designed negotiation strategy that safeguards workers, as well as ensuring that our workplaces are healthy and safe.
It is predicted that people in less protected and low-paid jobs, particularly youth and older workers, women and migrants, are also more vulnerable due to lack of social protections and rights.
The hospital has also brazen up to, first of all, identify probable cases and refer appropriately, and also to protect our own staff, the healthcare personnel, from getting infected. And what has the hospital done to this effect? Number one, we have developed a protocol that the hospital, all the hospital staff must follow in terms of prevention of this disease.
But as far as psychiatric hospital is concerned, we are fully prepared. By the time you are entering into the hospital, you must have seen the basin that we put there. You have to wash your hand before you come into this hospital. And just last week again, the management, had to get supplies, of most preventive material like the sanitizer, face masks, hand gloves, and all that. And we distributed that around all the clinics and wards. We've been doing all that. And even presently, we have infrared and every other thing. So as far as psychiatric hospital Yaba is concerned, the management are fully prepared, and we are prepared there. And apart from that, we've been doing a kind of psychological work. We've been telling people, don't be panic, because the most important thing is that you must not be panicked. Once you are not panicked, you are not likely to make any mistakes. After that, you take it up from there.
What we are trying to do as a social worker and all the members of psychiatry is to tell people that they should not panic. Because when you have anxiety, it might also lead to a lot of issues. So what we have to do is a global issue whereby every one of us have to take things easy. And how do we take things easy is that we have to follow all the rules and regulations that has been laid down, like maintaining personal hygiene, hand washing. In psychiatric setting, if you start washing your hand more than necessary, they have another name, we call it obsessive compulsive disorder. But now, it's no longer a disorder now. We have to wash our hand properly to make sure that things are well done. And at the same time, we should also try as much as possible to keep a distance from each other, so that even when you want to sneeze or you want to cough, at least that thing will not affect the person nearer to you. So I believe that by the grace of God, our governments will do their best to make sure that they curb this coronavirus, COVID-19, so that it won't keep on spreading and spreading and spreading.
Joining me on the program is the president of the Joint Health Workers Union, JOHESU, and also the president of the Medical and Health Workers Union of Nigeria. It's good to have you on the program.
It's a pleasure having me in the program too.
It's a very enormous task for medical workers right now in Nigeria and of course all over the world. Can you share with us what is the plight of medical and health workers at the moment in the country?
Thank you so much. I think it is a very brilliant task for health workers, particularly in Nigeria and all over the world. I want to say, particularly in Nigeria, you all know how it is. At this hour, you know that my members are the first responders, the environmental health officers who are in the and all that. They are who will have to get the closest of contact who are coming in. More so that you are. Nigeria has very not a homegrown coronavirus. Virtually all the cases are imported cases. So it's very difficult time for health workers. But because we have signed on to do this job, not also shy away from doing our job, as much as properly motivated to do it.
Okay, very recently I'm aware that JOHESU actually threatened to go on an industrial action. Can you share with me what's the update of that? Looking at the fact that the world is faced with a very challenging situation at the moment, what's the response of your members when it has to do with welfare at the moment?
Thank you for that. Actually, when it comes to welfare, my members have not been given the fair share. They have not been really treated properly. But of course, as people who are patriotic as always, you know, when we met with the president recently, we told him that even though we are kind of sidelined in coming into making the decisions here, we told him it was a recommendation that, look, we may be starting a celebration or preparing for celebration that we are done with the case. But that if we must then maintain that status, we have to restrict flying in to just 2 international airports. And if, of course, we would have also said it should be a total lockdown, but sometimes, you know, when you don't wait for the experts to come and then you get some suggestions, they will say, oh, was he there in the meeting? So, but of course, our people are the first people to meet, as I said. So welfare has not been very good with us. A lot of things are deprived us. Agreements signed are not implemented. But the president promised that they're going to look into it. I believe this is the right time for the government to also look at our own plight so as to motivate our people maximally to get ready for the worst days to come. Okay. We prayed, we didn't get there, but we are just praying. We are just preparing ourselves. PPEs should be provided. That needed motivation should be given so that our members, of course,
from the feedback that you're getting from your members, can you say that they are well protected in terms of precautionary measures that should be in place for the workers?
Well, I would like to tell you that a full assessment of whether they are well protected or not will be done in the coming days, because, you know, up to now, the whole issue was confined to a very small and narrow space. And so verily, the government, I believe, was doing well in those small gaps. But right now, as the threat is widening, and that is when we're going to see if, because you need a larger number of participants in the whole scheme, and so We will then see whether there are gaps that needed to be filled or not. But of course, for now, I want to tell you that my people are patriotic, and we are expecting the government to also reciprocate our patriotism by trying to improve our welfare and meet things that have been denied us, so as to give us real strong motivation to take the risk that maybe many will be afraid to take.
Thank you very much for joining us on the program. The program continues with the Regional Director of the International Labour Organization, Dennis Zulu. It's good to have you on the program.
Thank you so much.
There's this prediction from the International Labour Organization that between 5.3 million jobs to 24.7 million jobs would be lost all over the globe in this year 2020. What does this mean for Africa?
Well, it's very Africa, given the fact that Africa already very many challenges, including that of employment levels. So what this basically means is that whatever progress would have made in terms of job creation on the continent will be regressed factors backwards. In particular affected will be those working in the informal economy. It accounts for a significant proportion of Africans working. Certain categories of workers will be, especially those in the services sector. And here I mentioned also that given the fact that women account for a proportion of people working in the services sector, it will affect them more, as well as the young. So the outlook is really not good, given the fact that we're starting already.
Okay, looking at the fact that the outlook is not really good, how do you think workers can be protected in the workplace? Because workers actually have to work to earn their living. Looking at the formal workers, what do you think workplaces can put in place to ensure that we don't have many more workers subjected to this pandemic?
I think one of the biggest things that are being poured now is to ensure that the workplaces are kept in a clean and hygienic way. So one of the things that employers have to do, obviously working with workers, is ensure that the workplaces are clean and also virus-free. But the second most important thing that we need to ensure that workers are protected through the different legislations and policies that are in place. For instance, Nigeria has an occupational health and safety policy, but also has legislation that protects workers in as far as safety and health is concerned. So it's important employers and workers ensure that they abide by these guidelines and policies, but also on the part of government, it's important also that they play their role in ensuring that the workplaces are inspected to ensure there's compliance with the rules. But in a situation where it gets worse, in countries, there are various other measures that can be taken. For instance, asking workers to work from home. But for Africa, this might be a particular challenge, given the fact that not so many workers have access to laptops or internet.
Yeah, sorry to cut you in. Talking about working from home and telecast and the possibility, what alternative work methods do you think Africa can actually adopt to ensure that we still have people working in the environment or in the country?
Well, unfortunately, because we do not have access to teleworking facilities, I think this might even render the whole challenge or make the whole problem worse. Because what has happened in other countries, workers have still been able to contribute to the productivity of work from home. But if we cannot have or do not have access to the tools that are needed to work from home, then it makes the whole problem much more difficult. And this is also it's very important because there are certain things really that have to be done. If they can't be done from home, then the productivity is affected. But also in the case of Africa, you notice that a lot of the work that is done in the different sector really is that which is labor intensive and really does not render itself to telework. I'm talking about work, for instance, in the agricultural sector, which are basically people working. So in this instance, what normally happens is that workers are asked to stay away. And when they stay away, that means there's no productivity. But an outcome of workers staying away means that they will not be paid. If they're not paid, they might run themselves into facing difficulties of sustaining. So what has been happening in some of the countries we've noticed is that they and some of the employers have taken on the burden of paying the workers to ensure that they're able to buy food, they're able to pay for their children, but this cannot be sustained. The business unlimited resources to support workers if they're not getting back an income through the goods and services. So it's a particular concern because there'll come a time when ultimately the employer will not be able to sustain and will have to lay the worker. And this really accounts for the statistics that you talked about earlier on, because business cannot sustain the workplace, will have to lay them off, and therefore will have big numbers of workers not having jobs or losing their job.
So as sorry to cut you in, so as the regional director of ILO Africa, what would be your recommendations to ensure that government play its role in ensuring that businesses keep moving?
Well, I think there's already practice that has been determined or has been done elsewhere, and the things that we thank God at the moment that the pandemic is not as serious as it is in other parts of the world. So this gives us a learn as to what is being done elsewhere. But I think to a great extent, the government has already prepared itself for an eventuality. But some things that have done to ensure that the workers and enterprise is protected, for instance, is by providing the necessary incentives for business to be able to operate in these trying conditions. For instance, providing tax incentives to be able to use the savings to ensure business continue running, but also ensuring that the workers are paid. Making access to finance much easier is also very important because companies have to support productivity. They have to pay for goods and services, their inputs into their properties. So because they cannot get or they cannot produce levels that they were, they'll have to access credit somewhere. So it's important that government comes in with a range of policies that will sustain or support the continued running of businesses in the country.
Okay, the International Labour Organization Director, Guy Ryder, spoke about international coordination. What does this mean for Africa and the world?
Well, coordination is particularly important at this stage because, as you know, the pandemic is basically touching almost every country in the world. So if we're going to have a successful ending of the pandemic, it's important that different countries work together. And in this case, there's the whole discussion around free trade, especially with the assenting of the Africa Continental Trade Area several months ago. It's important that perhaps Africa looks within itself to see whether it can enhance in its supply chain, for instance, to procure the goods and services need production within the continent. You'll note that China, which basically supplied a lot of goods and services that input into production in the continent, was severely affected. And this ultimately has affected Africa as well. So really, I think one of the things we need to be looking at in terms of collaboration on the continent of Africa is seeing how we can work collectively together, looking for opportunities to grow intra-Africa trade in as far as the inputs, but also looking at Africa as a large market. I mean, there's a huge market in Africa which needs to be satisfied, and perhaps through collaboration and coherence amongst our policies, it can be an opportunity to see how we can work together and collaborate well together.
Okay, so finally, we know that international coordination is one of the ways of tackling this pandemic that Africa is actually faced with. What more would be your expectations from Africa leaders in terms of ensuring that the economy actually is more viable? Looking at Nigeria, for example, the price of crude oil has actually fallen. What would be the recommendations in terms of ensuring that many African countries doesn't slide into recession?
Well, I mean, it won't be easy, I must say. I mean, given the fact, as I said, most of the African countries are affected by the fact that most of their goods and services that they're able to produce locally cannot go out to the external markets, and this has affected the prices. Let me say, as you stated, of crude oil and other primary products have fallen tremendously. So there's a lot of work going behind planning and ensuring that support is provided to the private sector, which is primarily responsible for the creation of jobs in this country, but also making sure that the workers' rights are protected, because that's particularly critical, because you cannot have production with workers. So I know, and as I said earlier on, I think the fact that the pandemic is only reaching Africa now after it's been quite serious in other parts of the world has provided Africa with an opportunity to think through different strategies to ensure that the impact is not as severe as it would have been if we hadn't been given this lead time, so to say. But the political leadership is there, and they're working very hard to the appropriate strategies are put in place to get Nigeria back to where it's supposed to be as soon as this pandemic is managed.
It was an interesting conversation I had with you. Thank you very much for joining us on the program.
So much. It's been my pleasure.
And that's all we can take on today's edition of the program. Join us next week for a fresh edition of the show. I am Sharon Ijason. Thanks for watching, and remember, labor creates wealth.